We often think of pregnancy as this kind of mysterious 9-month biological event, but really, it's an incredible, well-documented journey, and it even has a clear roadmap. Today, we're going to walk through that map together, from the very first spark of life all the way to the critical check-ins that help ensure a safe trip.
So, here's the plan for today. First, we'll start at the very beginning, with that initial spark and the life support system it builds. Then we'll figure out how to decode the body's earliest clues. After that, we'll look at the 9-month medical roadmap, and we'll wrap up with how to navigate all the changes in both your body and your mind.
All right, let's dive right into our first section. This is really where the magic happens. We're talking about the transformation from a single cell into a fully supported embryo. It's the foundation for everything that follows. Okay, check out this incredible sequence of events. It all kicks off with ovulation. That's when an egg is released. Next up is fertilization, which usually happens in the fallopian tube. Step 3, that's implantation. The fertilized egg finds a home and snuggles into the uterine wall. And right after that, fetal development begins. Those first few weeks are just so critical.
And get this, to support this new life, the body literally builds an entire life support system from scratch. It's amazing. You've got the placenta, which is like the engine, pumping in nutrients and oxygen. The umbilical cord is the lifeline, of course, and it's all surrounded by amniotic fluid and a protective membrane, creating this perfectly safe, cushioned, temperature-controlled little world.
So with all of this happening on the inside, how does anyone even know they're pregnant? Well, the body starts sending out signals. They can range from these really subtle whispers to, undeniable announcements. Let's decode them.
And this is the question, right? You miss a period, you're feeling exhausted, a little nauseous. Is it pregnancy, or did you just have a really stressful week? The earliest signs can be so ambiguous, it's hard to tell.
This chart is super helpful because it breaks it all down. You've got 3 categories. First are the presumptive signs. Think of these as the subjective hints, what you feel, like nausea or fatigue. Then you have probable signs, things a doctor can actually observe, like a positive test or some physical changes to the cervix. And finally, you have the positive signs. This is the definitive, 100% proof, like seeing the fetus on an ultrasound or hearing that tiny little heartbeat.
Now, the star player in that probable category is this hormone, HCG. This is the exact thing those home pregnancy tests are designed to find. You can think of it as the official biochemical announcement that there's a pregnancy. Its main job is to keep progesterone levels high, which is absolutely essential for creating a healthy environment for the embryo to thrive.
But it is important to know that while a positive test is a very, very strong sign, it's not always 100% foolproof. In some really rare cases, certain medications can actually cause a false positive. And that's exactly why getting it confirmed by a healthcare provider is always the right next step. Okay, so once the pregnancy is confirmed, what happens next? What's the plan? Well, that brings us to section 3, the medical roadmap. See, it's not just about waiting for 9 months to pass, it's a really structured process of monitoring, screening, and education.
The whole journey is broken down into 3 trimesters, and each one has its own unique focus. The first trimester, that's all about setting a healthy foundation. The second trimester shifts gears to monitoring growth and screening for potential issues. And the third trimester, that's the home stretch, focusing on the final prep for labor and learning to spot any last-minute warning signs.
Okay, now this might look a little technical, but it's actually a super clever shorthand that clinicians use called GTPAL. It gives them a quick snapshot of a person's entire pregnancy history. G is for gravida, total pregnancies. T is for term births, P for preterm, A for abortions or miscarriages, and L for living children. In just a few letters, a provider can understand so much context, which helps them give the best possible care.
And driving everything behind the scenes is this incredible hormonal engine. Think of these hormones as a complex navigational system for the whole pregnancy. And what's so fascinating is seeing the direct link here. Estrogen's job is to help the uterus grow, and a side effect of that can be things like leg cramps. It's all connected.
All right, our final section. And this one might be the most practical of all. It's about navigating the day-to-day physical journey, learning the difference between the normal, kind of bumpy parts of the road and the really serious warning signs that mean you need to pull over and call for help right away.
This is so important. Knowing the difference between these 2 columns is one of the biggest takeaways. The stuff on the left, nausea, heartburn, backaches, those are common discomforts. Yeah, they're unpleasant, but they're usually normal. The items on the right, though, vaginal bleeding, severe pain, those are potential danger signs. They are in a completely different league and mean you need to call your provider stat.
So let's be crystal clear about this. The items on this list are non-negotiable. These are signs that something might be seriously wrong, and they require immediate medical attention. This is not a wait-and-see situation. It's a call your provider right now situation. And, one of the best ways to navigate this whole journey safely is by being proactive. And that's where folic acid comes in. It's a simple B vitamin, but it has a massive impact. Taking it helps prevent major birth defects of the brain and spine. It's truly a cornerstone of prenatal health.
And this is why all this stuff matters. This is why we're going through the roadmap. It's not about memorizing facts. Understanding the process empowers you. It helps you make healthier choices, recognize when something is wrong, and it can turn a lot of that anxiety into informed action. It really makes you an active partner in your own healthcare.
So, we'll leave you with this question to think about. We've gone over the complex biology and the detailed medical plan, but with this whole roadmap in hand, what's the single most important element for a safe journey? A lot of the time, it comes down to something much simpler: open communication, really listening to your body, and building a trusted partnership with your care team.